Over, we have some slides. What we're going to do is start with a little presentation to just give everybody a little bit of an awareness of what's going to happen to Coach John, and then we'll set him up on the bike. So for those of you I haven't met, I'm Dr. Falconi. I'm one of the co-founders here with Dr. Hopkins, and we just wanted to say thank you for coming to support us today. We really appreciate it. And we'll get started. All right, so first things first, like what is a metabolic test? What's the purpose of it? So the reason that we really, these really got popularized is for the athletes, mainly endurance athletes, and we wanted to find out how efficient they were at creating energy or utilizing energy during their races. So luckily we've come a long way from this machine here to now very much portable handheld machines. We can just slap on the mask. There's even some that you don't even need a machine. It's all in the face mask. So it's pretty cool how far it's come. All right, and then what are we checking for? So a lot of times we'll pair this with what people most commonly use, which is a heart rate monitor. And then what is the mask checking? It's checking how we consume oxygen and push off CO2. And that in turn tells us about glucose and fat metabolism, which is basically how we use energy. So that's what we're checking with the mask. With that, we're able to create zones. So everybody at this point has now heard of zones. Everybody loves zone 2 right now. That is what we're extrapolating out of the test, is what zones you need to train in to optimize your performance. All right, so what does the metabolic tell us? The first things first is the VO2 max, which again is the most popularized thing. The reason it is because that was that first metric we were actually looking at. So we thought VO2 max was everything back in the day. We're now learning more and more. There's a lot more to performance, but that is a great marker not only for kind of your ceiling, but also now we're finding more and more about longevity. Okay, the next thing we learn is your metabolic flexibility, another hot topic right now that everybody's talking about. So that is, in simplest terms, how well we use glucose and fat and how well our body is able to transition between those two. Fat, you can think of as like your hybrid car. It's the electric, right? It gives you the most energy for the most amount of time. Your glucose is your power or your gas, okay? Fat is great because we have a ton of it stored. We can use it for a really long time. Glucose is great for high intensity, but we only have so much. The other thing we look at is lactate metabolism. So this is kind of the stuff that I have started to delve into because this is a much better metric for performance. As we get through the slides, you'll see that we're kind of going away from VO2 and getting into lactate metabolism because it's more linked to how well we're actually going to perform in an event. All right, so what is VO2 max? It's basically how much oxygen we can consume at our highest intensity. That's the simplest terms. Like I said, it is the ceiling. So while it's not going to tell me a lot about your performance if you're trying to get more fit, it is going to limit you if it's low. And so sometimes I'll see an athlete who, otherwise is using fat really, really well, but their VO2 max is low for their age or for their sport, and that's actually what we have to target to bump up their ceiling to then be able to be more efficient for longer. And again, like I said, so VO2 max has very much been linked to longevity recently. The coolest thing, or what I really want to hit on is, as a doctor, the biggest thing that I was brought up to look at is chronic disease risk factors, right? We're always like, do you have diabetes? Do you have hypertension? Do you have high cholesterol? If you do, you're going to die this much faster. So we're now starting to understand that if we look at VO2 max, it's actually a positive metric for longevity. So instead of focusing on the negative, we can focus on the positive, especially coaches. VO2 max is protective for longevity. As just simply bringing up your VO2 max from low, which is that first box there, to below average, so very, very low standards, we are able to cut all-cause mortality by 50%. So just huge gains you can make for someone that you're trying to get back into fitness and kind of buy into this theory. All right, next we're going to go into metabolic flexibility. What I have here, if you don't remember your high school biology, is a mitochondria. I want to talk about the mitochondria because it's basically at the root of most disease, and it's also at the root of performance. So it's very much like this coin flip, where if you look at a Tour de France cyclist, which probably has the best mitochondria in the world, the most healthy people, and you look at someone with chronic disease, it's all about the mitochondria. The reason it's, the powerhouse of the cell. The reason it's so important is it is what controls our ability to oxidize fat and utilize glucose. It's supposed to know when we transition. When we start to get that mitochondrial dysfunction, the mitochondria no longer knows how to use fat, which is that first step towards prediabetes, diabetes, and inflammation. So again, this is great, getting people to understand that health starts at the mitochondria, and the way you make mitochondria healthy is zone 2 training. One of the biggest things is zone 2 training, which is why it's now being ramped up as this thing that everybody is looking at, because that's one of the easiest, fastest ways to target mitochondrial health, and then also glucose metabolism, so teaching your muscles how to utilize glucose. All right, so we have this graph here. I'm going to kind of introduce you to it. So on this side here, we have glucose utilization in red, and then we have, that's fat oxidation in red, and then we have glucose in blue. So our crossover point is where those two cross. So when we're talking about optimization at like your aerobic capacity or your zone 2, it's trying to manipulate your ability to oxidize fat for longer at a higher intensity. So down here is heart rate, if you want to associate intensity with heart rate in this graph. So when we compare a recreational athlete to a world-class athlete, we have a crossover point here for the recreational athlete at a heart rate of 138, and then a crossover point here at a heart rate of 167. So imagine that you're doing a workout and you can have a heart rate of 167 and you're still burning fat. You're not burning glucose. So that is what these elite class athletes are able to do. It's not that they're able to be at a 80%, 90% intensity for hours. It's that is their 50% intensity. And we assume that they are running at their highest intensity. Let's just bring a marathon runner who's running a 5-minute mile. That is their 50%. Right? So it's like they have changed their physiology so much that they can utilize fat for that long. Okay, so the next thing I want to talk about is the lactate threshold. That's kind of what we're going to do today in the test. You'll see me pricking John's ear. We're gaining his lactate throughout the test. The reason that this started to kind of trigger my interest is I was listening to some podcasts. Inigo San Milan is the best. If you listen to him, you'll learn a lot. So he was finding out that he trains the current Tour de France winner, and he's also a cancer researcher. So he kind of hits both of those spots. But what he was finding is that there was all of these athletes that would have a similar VO2 max, and there would be one athlete that would just extremely outperform the other. And so he was trying to figure out what's going on, why is this happening? So he has very much tied that to lactate. So now he will check lactate on these people and find that the person with a better lactate threshold is actually performing better. All right, this is from one of his papers. Also another thing I highly recommend that you read. So it was a really cool study where he tested 3 subjects, 3 subject pools, but a lot in each pool. Okay, so the first one was here, which is your elite cyclist. The middle one was your moderately fit athlete, and this was your athlete with metabolic disease. We have our blood lactate on the left, and then we have our absolute workload in wattage. So these were done on a bike, which is why wattage is the metric that we were looking at. And what we're going to focus on today is a lactate threshold of 2. So why that matters, that's what we found was that point at which your body starts to accumulate lactate in your first threshold. So very much associated with your zone 2. Okay, so just looking at LT1, you can see that the metabolically unfit person is pretty much starting to collect lactate at rest. They started the test, their lactate was at 2. okay? The moderately fit person was able to get to a wattage of 150, which we'll see kind of that'll be put into perspective for you when John jumps on here, to then hit that lactate threshold. And the elite athlete was able to get at a wattage of 300. I can't even do a wattage of 300 if on my best day as a sprint. So it's like very much mind-boggling to think of somebody at their 50% at a wattage of 300. Again, we'll see what he caps out at, but most of my athletes have barely hit their VO2 max at about 220 to 240. So I've yet to find someone that is that aerobically fit, which I don't expect with CrossFit. That's just not our intent, right?
So expectations are low.
Yeah. So what we'll really want to see with John more is we're going to be looking at how much lactate he can actually live in, which is what CrossFit athletes are best at, is they can kind of hang out in between a lactate threshold 1 and 2 for a longer time, and then they can be in a high lactate for a longer time. All right. The other thing that's just really amazing about lactate is it's very much trainable. You can train your body to not only be better in lactate, which is what most Metcons are, is like really high intensity, really short duration. You learn how to just live in it, but you can actually do lactate shuttle training is what they call it, where you start to accumulate some lactate, then you drop down to zone 2, and you teach your type 1 muscle fibers to actually consume lactate as energy. So you actually create this thing that we thought was terrible, which is lactate, but it's actually energy for the type 1 muscle fibers. And so you can do this type of training and end up consuming lactate better throughout moderate intensity between your 60 to 80%, and then you last longer.
Would that be why like a cool down is important, like post an intense workout, to like maybe burn through some of that lactate and be less sore?
Yeah, not necessarily. It won't mess with soreness all that much, but yeah, I do recommend for my athletes to jump on a bike afterwards at a very low intensity to try to use that. If you don't have time to do lactate shuttle training, then every time you do a Metcon, you jump on the bike after and you start training your type 1 muscle fibers, which are they're only going to work at a very low intensity, very low power output, to start pulling in lactate.
Audrey, can I ask a question? Can you remind me, lactate threshold, am I thinking about the different energies like phosphagen, glycolysis, oxidative? Is that kind of what you're referring to?
Yes, you can, but that's very much intermixed now. So now it's the thought was that we would go from phosphagen to glucose, right? And it's like, it doesn't work that way. We're using them all at the same time. And so basically, probably, if you're up to date with physiology, you're going to start to kind of throw that out, and you're going to think about energy utilization a lot differently.
Okay, so we're just kind of redefining everything now. Okay.
Yeah, so we have lactate in our system at rest. It's never not there. We're always going to have a little bit of like glucose utilization, which leads to lactate. It's just how efficient you are at clearing it out. So this is basically a 3-month interval here. So you can see that this was the initial test, this was the second test, and there's a shift. The bottom here is watts per kilo, so it's a way for like John and I to be able to compare. He's a lot larger, he should be able to generate more force, so we can have an equivalent test if we do watts per kilo. So from that 3-month mark, that lactate 1 switched from a 3.5 all the way over to a 5 watts per kilogram. So pretty impressive change in the ability of how much power that they can generate at their 50%. All right, any questions? No?
What do you mean when you say at 50%? Do you mean 50% maximum output, but 50% of the glucose that you're using?
So we'll just say like a 50% effort. So this, keeping your lactate below 2 is basically like you're cruising, you could have a conversation, somebody could probably tell that you were working out, but you could still talk in sentences. That is what, like an easy way to think about your zone 2. All right, any other questions?
The world-class athletes you're saying that are now, like their physiology is changing and they're utilizing fat more, is that also in correlation to the lactate threshold?
Yeah, so they're shifting 2 things. They're shifting, 1, how long they can use fat, which then allows them to save glucose for their kick at the end. And then they're also training their ability to utilize lactate. So there's two metrics you're typically training when you're hanging out in a zone 2, both of those things, which you can also manipulate with diet. So if you go keto or more fat, you're going to try to force your body to use fat better. And then like a lot of times what I'll do with my own diet is I'll stay on a low carb diet until I'm going to do a competition. Then I eat carbs and my body's going to be like, oh, now I have a super boost, right?
Yeah.
I don't need to use pre-workout or caffeine. I'm just manipulating my diet.
Okay, cool, thank you.
Yep. Anything else? Cool. All right, so I'm going to go get set up with John and we'll be back.